Hello and welcome. Today, we'll be discussing a common yet often embarrassing condition, urethral incompetence. We'll explore what it is, why it happens, and what can be done about it. So, let's dive in and shed some light on this important topic. Urethral incompetence, also known as stress urinary incontinence when associated with physical exertion, can arise from a variety of causes. Weakening of the pelvic floor muscles, often due to childbirth, is a primary culprit. Damage to the urethral sphincter, which controls urine flow, can also contribute. This damage might occur during surgery, particularly prostate surgery in men, or after traumatic injury. Hormonal changes, especially after menopause in women due to declining estrogen levels, can also affect urethral support and function. Other factors include obesity, chronic coughing, and conditions that increase intra-abdominal pressure. The pathophysiology of urethral incompetence centers around the urethra's inability to effectively resist pressure from the bladder. Normally, the urethral sphincter and supporting pelvic floor muscles work together to maintain continence. However, when these structures are weakened or damaged, the pressure within the bladder, even with relatively small amounts of urine, can exceed the urethral closure pressure. This results in involuntary urine leakage. In cases linked to hormonal deficiencies, the urethral lining can become thinner and less pliable, further compromising its ability to seal properly. Urethral incompetence is a prevalent condition, particularly affecting women. Its incidence increases with age, with a significant proportion of women experiencing it after menopause. While less common in men, it can occur following prostate surgery or due to other medical conditions. The exact prevalence figures vary depending on the study population and diagnostic criteria used, but it's estimated that millions of people worldwide are affected, significantly impacting their quality of life. The hallmark sign of urethral incompetence is involuntary urine leakage. This leakage typically occurs during activities that increase intra-abdominal pressure, such as coughing, sneezing, laughing, lifting heavy objects, or exercising. The amount of leakage can vary from a few drops to a larger volume, depending on the severity of the condition. Other symptoms may include a frequent urge to urinate, difficulty emptying the bladder completely, and a sensation of pelvic pressure or discomfort. Diagnosing urethral incompetence usually involves a thorough medical history and physical examination. The doctor will inquire about symptoms, medical conditions, and medications. A physical exam may include assessing pelvic floor muscle strength. Further diagnostic tests may include a urinalysis to rule out infection, a post-void residual volume measurement to check bladder emptying, and aerodynamic testing. Aerodynamic testing assesses bladder and urethral function during filling and emptying, providing valuable information about the underlying cause of the incontinence. While urethral incompetence is a broad term, specific types are often categorized based on the underlying cause. Stress urinary incontinence, the most common type, is directly related to increased abdominal pressure. Urge incontinence, also known as overactive bladder, involves a sudden, uncontrollable urge to urinate. Mixed incontinence refers to a combination of both stress and urge incontinence. Understanding the specific type is crucial for guiding appropriate treatment strategies. Treatment and management of urethral incompetence range from conservative measures to surgical interventions. Conservative approaches include pelvic floor muscle exercises, known as Kegel exercises, to strengthen the supporting muscles. Lifestyle modifications, such as weight loss and limiting caffeine and alcohol intake, can also be beneficial. Bladder training techniques can help improve bladder control. Medications may be prescribed to relax the bladder muscles or improve urethral sphincter function. In more severe cases, surgical options, such as slings or bladder neck suspension, may be considered to provide additional support to the urethra. Preventing urethral incompetence can be challenging, but several measures can reduce the risk. Maintaining a healthy weight, performing regular pelvic floor exercises, and avoiding smoking are all important. For women, practicing proper techniques during childbirth can help minimize pelvic floor damage. Addressing chronic coughs and constipation can also reduce intra-abdominal pressure. While not always preventable, adopting these healthy habits can contribute to better bladder control throughout life. The prognosis for urethral incompetence is generally good, with many individuals experiencing significant improvement with appropriate treatment. While complete cure may not always be possible, management strategies can effectively reduce symptoms and improve quality of life. Ongoing research is focused on developing less invasive surgical techniques and exploring new medications to further enhance treatment outcomes. Recent advances include the development of adjustable slings, allowing for fine-tuning of urethral support after surgery, and the exploration of regenerative medicine approaches to repair damaged urethral tissues.